The federal government has approved the disbursement of 38 billion naira to health facilities under the Basic Healthcare Provision Fund as part of the ongoing reforms to strengthen primary healthcare delivery nationwide. Speaking after the Ministerial Oversight Committee meeting, Coordinating Minister of Health and Social Welfare Mohammed Ali Pate said the funds are already reaching facilities with plans to expand direct financing to 5,000 additional centers. He highlighted gains in emergency obstetric care, noting that over 40,000 women have benefited from free treatment under the initiative of President Bola Ahmed Tinubu, alongside more 4,000 fistula cases treated.
On primary health care, in terms of utilization, in terms of maternal mortality, slight reduction, in terms of immunization, things are moving along, and the resources that the federal government is disbursing through the BHCPF is getting to the facilities. We also approved the disbursement of 32 billion naira to the BHCPF facilities, the existing facilities, based on the reform guideline that we had approved last year. We are on our way to expanding the facilities to add 5,000 more that will be receiving direct facility financing. The MOC also looked at the tariff for emergency ambulances and increased the tariff rates so that others, private sector and public sector providers, can be compensated for providing emergency services. It's important to note that the Comprehensive Emergency Management of Obstetric Services, the CMONG, the reimbursement for complications of obstetrics deliveries, appears to be doing very well. More than 40,000 women have had emergency services reimbursed. That made it affordable for them and their family. And there is widespread acknowledgement that the vision and wisdom of the president to make treatment of emergency obstetric services free, in fact, is touching real lives of women. We've also seen the free fistula program is reaching more than 4,000 women who have had their lives reclaimed. The neonatal, the reimbursement for neonatal care is also beginning, even though it's too early to say. We debated on maternal mortality rates and the narrative. The truth is that Nigeria is doing well in terms of efforts to improve maternal and child mortality.
Minister of State for Health Isaac Adekunle Salako emphasized the government also recorded major strides in disease control and immunization, reaching over 102 million children in a nationwide measles and rubella campaign, while strengthening transparency and accountability in fund utilization with support from civil society groups, according to Minister of State for Health.
We normally push and also promote and train people to take personal responsibility in terms of protecting themselves before they attend to patients, and to also have high index of suspicion, where especially when it is seasons like this. We will continue in that track. If you were part of that meeting today, you see the NCDC also conducting trainings for health workers to improve their knowledge and their skill and their response to protect themselves. This is an ongoing effort which we believe that will continue to drive. For me to highlight that the way we are promoting transparency, stewardship, and accountability with the robust involvement of the civil society organizations, and I think that's very good, is an exemplary move to ensure that the civil society is part of this delivery, and they can also help us to track and monitor at facility level to ensure that Nigerians actually are getting value for the money that the government is invested, particularly in primary healthcare delivery system. I think that's also another important point that's coming from this meeting that I would like to highlight.